Hi, Anne.
Hello. Hi.
Can you hear me?
Yes, I can. Thank you.
Excellent, excellent. So I've got a couple of questions, and they are rather interesting questions for you. The first one is, can can these bacteria that you've talked about be reduced in all birth channels? That's the question. Is there a way you can influence the birth channels to reduce these bacteria?
Okay, if I understand the question, are you saying whether you can influence vaginal microbiota and therefore affect the the gut microbiota of the infant? Is that what the question is?
I suppose so. It's from one of the participants.
Right. Okay, so I mean, at the current moment, obviously, we do not really change or want to influence the vaginal microbiota. We actually encourage most mothers to deliver vaginally because that is the natural way of delivery, so that the infant will acquire the microbiota that will be in the birth passage along when they are delivered. Okay, these are sufficient to colonize the infant gut bacteria. We don't really want to change the vaginal microbiota because the only way you're going to do that is probably by either giving antibiotics or I don't think you want to introduce any other forms of bacteria into the mother during this whole. So, I mean, and we do know that definitely antibiotics will influence microbiota, whether it's in the vagina or in fact, when you're giving it systemically, it will affect all the microbiota in the whole maternal body. And that has very adverse effects actually on not only the mother, but by the fact that you're changing the maternal microbiota, that has also an impact on the baby. So that definitely, we definitely do not want to manipulate the microbiome in any way that is not necessary to be manipulated. Yeah.
Thank you very much. And the other question that looks like it is this: how does the mode of delivery, either vaginal or C-section, influence the gut microbiota of the infant?
All right. So, I mean, as I mentioned that during delivery, the baby will be encountering the microbiome of the maternal vagina, right? And therefore, during delivery, whatever is found in the vaginal passage of the mother will be acquired by the baby. That's why you also will have some the fecal microbiome being transmitted to the baby as well, because obviously the vagina and the anus is very close by. All right, and these will be well, it's never totally clean during delivery, as you all know, and therefore the baby will be ingesting some of these and will acquire it during the birth passage. Now, obviously, during cesarean section, the micro when a baby is delivered by cesarean section, it's actually a lot cleaner, right? You make an incision and everything is sterile. You pull the baby out and it never encounters really anything from the vagina at all. So in that sense, what the baby, and of course we encourage skin to skin contact. So what they're going to encounter in terms of a microbiome is probably more a skin microbiome, because that's what they're going to contact first, and possibly a little bit of the environmental microbiome in a fairly sterile environment such as your operating theater, right? So it's a very different exposure to a gut microbiome that you're going to get, because the exposure of the environmental microbiome is a very different one. Hence, when you look at the microbiome flora in infants delivered by cesarean section and by vaginal delivery, it is extremely different. Okay. Yeah.
Excellent, excellent. That's very clear. The next question has to do with supplementing formula feeding in order to promote gut microbiota. Yet, formula feeding is discouraged in favor of breastfeeding because of risks of obesity and diarrhea. So the participant asks, what's your recommendation?
I mean, definitely for every baby, we always say breast milk is best, right? We
Yes.
encourage all mothers to breastfeed their babies, because not only as I said, breast milk has many bioactive agents within breast milk, and the mother is able to transfer antibodies from herself to the baby as well. And we know we've talked about human milk oligosaccharides. I mean, that's found abundantly in breast milk, right? So definitely breast milk is still best. We recommend that, of course. Besides that, is all this maternal infant bonding that is developed whilst the mother is breastfeeding, which cannot be the same when the baby is being bottle fed by various numerous caregivers. Yeah. So again, breast milk can supplement some of the things that I've been talking about. There's human milk oligosaccharides found naturally in breast milk. And human milk oligosaccharides actually function like a prebiotic, besides some of its other functions in terms of its immune function, such as decoy for bacterial pathogens. So definitely, we still want mothers to breastfeed. In human milk oligosaccharides is just one component in breast milk which has an immune function. I mean, there are so many others, lactoferrin and so on. So it's not just about human milk oligosaccharides. Yeah. So in a way, what we are doing with formula is that we are trying to mimic breast milk as much as possible. So definitely, formula will never completely replace human milk or breastfeeding. Yeah. I mean, there are obviously situations at times where breastfeeding may not be possible, and that's when you supplement with formula. And we want to make the formula as close to human milk as possible so that the baby benefits from it.
Well, excellent. So that approach is the approach of optimizing formula feeding when it is indicated, not as if it replaces breastfeeding. That's an excellent way to look at it. Then there's a question here. The participant was wondering, at what age would you want to consider starting the supply of probiotics or symbiotics, for example? For instance, in newborns born by C-section and not breastfed. Would you recommend preventative use or indicative use?
All right. So, I mean, if the data I've shown you about cesarean delivered babies is that obviously right from birth, there is a deficiency in bifidobacterium. And you will find that there is a delayed colonization of the infant gut with bifidobacterium in all the babies that are delivered by C-section. All right. So if you are going to try and correct this dysbiosis, because breastfeeding alone just to C-section babies is not going to correct it, because breastfeeding does not replace absent bifidobacteria. Okay, it provides the HMO, which is you could think of it as the nutritional source for the bifidobacteria, but the bifidobacteria has to be there. All right, which in most vaginally delivered babies, you will find that it is fairly abundant fairly quickly, whereas this is not found in cesarean section babies. It is relatively low in cesarean section babies, and it takes a long time to actually build up to a level that is found similar to vaginally delivered babies. So therefore, just breastfeeding babies who are delivered by cesarean section is not going to be enough to bring the levels of bifidobacterium up to that similar to a vaginally delivered baby. So if you're going to try and replace that, then you should do it early. It has to be soon after birth, not delayed, because eventually they will have bifidobacteria. It's just that it's much more delayed. Yeah.
Excellent. So the follow-up question to that is, if all of the children, whether CS delivered or vaginally delivered, will acquire bifidobacteria, at what point do you stop the probiotic supplementation? Is there a definite cutoff point?
Well, for breastfeeding, I guess we've always said breastfeed for at least the first 6 months. And I think for definitely developing countries, we encourage even going on for much longer. I think even after weaning the child, mothers can continue to breastfeed, because many of the studies do also recommend that even during weaning and introduction of solid foods, it may still be protective when you introduce some of these foods at the same time as breastfeeding. All right, so and it may reduce the risk of food allergy in some of these babies. Okay, so therefore, there must be appropriate weaning. I mean, breastfeeding shouldn't go on and be the only mode of feeding,
nutrition.
source of feeding for infants, but definitely it can be continued as a supplement during weaning. I don't think there is a very definite answer as to when we need to stop or even continue probiotics for. It's really taking each individual child and the situation they're going to encounter into account, to see whether you need to go on supplementing for longer, or is once they are nutritionally adequate, particularly after weaning, these supplementations may not be so necessary, and it can come from the solid foods.
Yeah. Thank you very much. So you mentioned the particular situation of each child. And so there's a question that says, in agrarian communities where women could be farmers and get exposed to pesticides, do these pesticides affect gut microbiota in their infants?
Okay, thank you for that question. I mean, we do know that obviously environmental exposures and allergens can affect the development of the microbiota as well. Pesticides are obviously not something that we want to be exposed to in huge numbers and huge amounts, because they're always obviously going to have some adverse effect, whether it be on the skin, or if you're ingesting it in large amounts, it probably will have some adverse effects on the individual. Whether we can even correct that with any of the current supplements is a little bit hard to say. I think we probably just have to be probably more aware of some of the adverse effects of overuse of pesticides, and maybe reduce the need to use large amounts of pesticides, and make the environment a lot safer for everyone to live in, rather than trying to remedy it the other way, after you've encountered the pesticide, and see what we can do about it. Yeah.
Excellent. I think that's a very practical approach to the problem. Now, there's one question here, and I think you might find it a bit of a stretch, but the question is, do we encourage pregnant mothers to take probiotic supplementation during pregnancy to improve the infant's microbiota?
Okay, I mean, obviously, there have been studies looking at maternal supplementation with probiotics. Many of the studies done were actually trying to see if we could even prevent allergy, because that was, that's one of the conditions that we are seeing increasing numbers of. That allergy seems to be on the rise, and allergic diseases seem to be on the rise, and therefore. Many studies conducted were looking to see whether we could prevent allergy, and they have used probiotics to supplement pregnant mothers, and their outcomes were really more to see if we could reduce allergic conditions. Most of those studies basically show that there may be maybe some benefit in reducing eczema. Unfortunately, it didn't really show a lot of benefit in reducing the development of a lot of the other allergic conditions. Okay, so that, which is also why most of the guidelines have not come out to be, to strongly recommend that every
Recommend.
pregnant mother must get a probiotic supplementation. Um, you, there probably is nothing to say you cannot, but they have not really strongly recommended that that all mothers, pregnant mothers, should be supplemented. They say those at risk, coming from highly allergic backgrounds, may consider supplementation, but that's at the discretion of the mother or the pregnant mother, and a discussion with their doctors probably. Yeah.
Okay, excellent. So it's basically discretionary. There are no firm guidelines on that at the moment. And
Right.
then there's a follow-up question. Well, not directly follow-up, but it says, is there a dose, as it were, a quantity of the human milk oligosaccharide that would promote the bifidobacterium, or is it just its presence?
Okay, so I mean, what has been found in most breast milk, that the commonest human milk oligosaccharide that is found is 2FL, okay, or 2-fucosyl lactose. All right, in a large number of mothers, if you look at them, they 2FL probably constitutes something like 75-80% of the HMOs that are found in breast milk. There will be some mothers who are not food to secretors, and therefore you might find that the 2FL levels in those mothers will be low. And therefore, yes, in a way, there is a kind of a dose relationship, in that most mothers who are secretors will produce naturally a huge amount of 2FL. There are a smaller number of mothers who are not secretors, and you might find will have lower numbers of 2FL. And that does have some impact on the infant. Yeah.
Oh, thank you very much. There's a question that looks like the medicine of the future. It says, could we consider fecal transplant from parents versus probiotic supplementation whenever we have cesarean deliveries? Do you see that as a potential therapy in the future?
Okay, they have not looked at fecal transplants. Obviously, most of the microbiota that's acquired will be vaginal, right? And there have been studies actually that looked at trying to get vaginal fluid and smear it on the baby, so that you are sort of transferring the vaginal microbiota to these infants that are delivered by cesarean section. So there were some studies that looked at it. I mean, and obviously they will be changing the microbiota somewhat. It's definitely not standard procedure. I don't think even most of the obstetricians would want to do this on a regular basis. There are some concerns, obviously, that you can be transferring also pathogenic bacteria to the baby, and therefore, they are not really routinely recommending that this should be done. Yeah.
Thank you very much. there is a question on whether maternal use of antibiotics in pregnancy could potentially affect the gut microbiota of the infant.
Yes, it can. So therefore, even something as recent as the many of the infants that are delivered by cesarean section, for example, the mothers would have received a dose of antibiotic very often, and again, that may contribute as well to the
Different.
disrupted microbiota that you are seeing, the difference in the microbiota, besides the fact that they are not acquiring it from the vagina.
Excellent. The final question, which, by the way, is mine, because I live in the tropics.
Right.
Vitamin D supplementation for infants. You've mentioned that it could be for those who are insufficient or vitamin D deficient. Should this supplementation be routine for developing countries where there is underlying undernutrition ab initio?
Definitely. I mean, most of the studies have basically looked at when they look at maternal levels of vitamin D and the outcomes of whether supplementation will work. Definitely is dependent on the level of vitamin D. If you're not going to be able to test every mother, and you're likely in the situation that you are in, that most of these mothers are likely to be vitamin D deficient or insufficient, then I do not really see that there is any harm in giving some supplementation with vitamin D routinely for these infants. Yeah.
All right. Thank you very much. For now, I think the the other question which we might have the opportunity of taking has got to do with noticing gastrointestinal infection in childhood. Is it something that can be noticed, or do you only find gastrointestinal infection in adults? I don't seem to understand the question more, more than that or better than that. Is that? I think perhaps the participant might be interested more in terms of allergy related to the GI. That might be something you could answer. I'm not sure it's about infection per se, but you could give it a try. Yeah.
Okay, I'm not terribly clear about the question. You are asking whether a disrupted microbiota could lead to a GI allergy, a gastrointestinal allergic condition. Is that what they're asking?
I would suppose so. The question wasn't abundantly clear to me as well.
All right. I mean, definitely, what the studies have shown that is that if there is a disrupted microbiota, there will be an increased risk of allergic conditions, and allergic conditions are not just we're not talking just about eczema, asthma, or allergic rhinitis. We're talking about food allergies as well, and food allergies can manifest obviously with gastrointestinal type allergies, besides the usually encountered IgE-mediated acute immediate forms of food allergies. So I guess in answer to that question, yes, it is possible that a disrupted microbiota could lead to gastrointestinal allergies. Yes, and that is also why in some of the guidelines, particularly with some of the functional gastrointestinal disorders that are encountered in infancy, where they attribute it to possible food allergy, they have tried using some probiotic supplementation as well.
Yeah. Thank you very much. Well, our very warm thanks to Professor Anne Gore. It's been a delightful session with you, and the participants were very engaging and engaged. I would like to thank you very much on behalf of the FrieslandCampina Institute. Just before we all go, please note that after this session, we will proceed on a 20-minute break. And during your break, you're welcome to visit the booth area, virtually, of course. And you can upload interesting materials, brochures, and videos to your digital briefcase, which will be available at the end of the conference. You could also visit the fun zone or join a brief session of meditation or shadow boxing. And thereafter, we will proceed with the rest of the sessions for today. On that note, distinguished ladies and gentlemen, it's been a most rewarding morning from Nigeria here. And once again, a very warm thanks to Professor Angor. Hope to see you in Singapore one of these days when I visit. And do have a pleasant rest of the day. Bye-bye then.
Yeah, I hope to see you too. Bye-bye.
Bye.
Bye-bye.